Hi, everyone. I'm Colleen, and I'm back for another live stream brought to you by the awesome people over at Princess Dental Staffing. Happy to see everyone on this Wednesday. So, today's topic, we are bringing you some dentist interview questions. Okay. So, I love streams like this because we get to not only directly, not only directly communicate with people providing interviews, but also with the interviewees themselves, right? Because we're going to be listing out some top interview questions for dentists. We're going to be talking about why these are important in the interview process. And we're also going to be giving examples of how you, as an interviewee, can potentially answer these questions, right? So we've got examples for everyone, okay, to really help you ace that interview, whether no matter what side of the table of the desk that you're sitting on. Okay. Alrighty. So before we dive into that, though, just want to remind everyone that each week Princess Dental Staffing is bringing you a new live stream covering a new topic regarding your career in the dental industry. If you don't want to miss out on future streams, be sure to follow our page or subscribe to our channel. If you like the content we're bringing you, drop us a like. And if you want to be part of the conversation, leave us a comment or a question or an insight or whatever you want to contribute to that conversation, okay? Additionally, if you have some time today, hop on to princessdentalstaffing.com. So, Princess Dental Staffing is an online dental job board, and they have positions available for dentists, dental receptionists, dental assistants, and dental hygienists in a variety of different areas, full-time, part-time, temporary, and permanent roles. So if you have some time today, visit princessdentalstaffing.com, see what positions they have available in your area. You can also create a profile and get your information in front of hiring managers. And you can also check out their blog, which covers a lot of the same topics that we cover in these live streams. Okay? Awesome. So let's get into these interview questions. Don't worry, it's not a real interview. You don't have to get anxious about it. Okay? This is just practice, okay, for dentists and for interviewers of dentists. Okay? So we'll go through these one by one. We've got 5 here. We're going to go through them one by one, do a deep dive, and then provide you with some extra ones that you may want to ask as the interviewer, or that you may want to prep for as the interviewee. Okay. All right. So question number 1. What is the biggest thing that has ever gone wrong? Excuse me. What is the biggest thing that has ever went wrong clinically, and how did you handle it? Okay. So this is an excellent question for interviewers because this really does give you insight into how the dentist can manage and respond to unexpected clinical incidents, as well as their commitment to patient safety and personal accountability as well, right? Um, the answer can also help you assess the dentist's technical skills, experience with dental procedures, and just how much they prioritize quality care services, and whether or not those levels, that level of quality matches your expectations, right? Whether or not they align with one another, right? It can also help you give you insight into whether or not the dentist can think critically when managing complex and unpredictable situations, right? No one ever sets out to make mistakes. Sometimes they just happen. So, this question, again, can really kind of help you assess, how the dentist responds in a not so favorable situation, right? So you'll want to, as the interviewer, you're going to want to look for things in their answer that indicate whether or not they take responsibility for their mistakes, whether or not they can appropriately handle patient complaints, because they may get a patient complaint out of it, right? And whether or not they can provide practical solutions, okay, that ultimately support patient safety and treatment effectiveness. Okay, so just in that one question, we can glean a lot of information based on the answer that the dentist gives. So, interviewees, here is an example of how to respond to that question. Okay, so again, the question is, what is the biggest thing that has ever went wrong clinically, and how did you handle it? Answer: the biggest clinical mistake I've ever made was overlooking a cavity during a patient's dental checkup. I realized my mistake when the next patient appointment revealed an infection and pain had set in. After apologizing to the patient for missing the initial cavity, excuse me, I took full responsibility for not noticing the initial cavity, so I offered to reduce the cost of treatment. To ensure this doesn't happen again, I am now more diligent in my dental exams and pay closer attention to every detail during a patient appointment. I also sought additional training on cavity detection techniques. Okay. So that is a really excellent answer because, again, not only have you, as the dentist demonstrated, the interviewee demonstrated that you have strong technical skills, that you prioritize things like quality care and services, that you have problem solving skills and all those sorts of things, but also that you were able to communicate with that patient. And come up with a resolution that can kind of um, help move through this particular issue, right? Like, for example, you apologize to the patient, and you also offer to reduce the cost of treatment to ease the financial burden on the patient. And not only that, but you also took the initiative to get additional training so that you could mitigate this issue in the future. Okay, that's another really important thing that you definitely want to kind of demonstrate in your answer, right? Not just fixing the issue, but endeavoring, taking steps uh, to ensure that this issue is not likely to present again. Okay, so all those things, really great points that were made in this sample answer. Okay. All right. So, next question. This is question number two. What is the biggest conflict between staff you've witnessed and how did you handle it? Okay. The fact of the matter is that adults work together anywhere between, 20 to 40 hours a week, depending, and you're not always going to get along with one another, right? So, as a dentist, you might witness some conflict. And in asking this question as the interviewer, this will allow you to assess the interviewee's ability to handle difficult situations, and also give you insight as to whether or not they will respond to a conflict that arises in the workplace, right? Whether or not they will try to alleviate the situation and improve it going forward. Um, it also demonstrates their ability to deal with disagreements and come up with solutions, and what kind of solutions they come up with, and if that kind of aligns with the values and the goals of your particular practice, and also demonstrates things like problem solving skills, communication skills, all those sorts of things. Okay. All right. So here, interviewees, here is the sample answer. The biggest conflict between staff I've witnessed was a disagreement about the best way to address a frustrated patient. One of the hygienists felt that we should confront the patient and set boundaries, while the other felt it was best to remain positive and try to de escalate the situation. I handled it by listening carefully to both sides and suggesting a compromise. I suggested that we maintain a professional yet empathetic tone with the patient while setting boundaries to ensure they felt respected. This solution made both sides happy and allowed us to manage the situation successfully. Okay. So, again, excellent answer. This interviewee was able to alleviate that situation by listening to both sides and making a decision, right? So this also demonstrates your decision making abilities, right? To be able to take in information, weigh that data, and make a decision that can keep everyone happy, right? As much as possible. Now, obviously, you're not going to be able to keep everyone happy all the time. And if that was the situation for you, then definitely talk about how what steps you took from there. Um, but ultimately, this is an excellent answer to the question. Okay, really demonstrates all those different areas that the potential employer is probably looking for. Okay, alrighty. So I like these first two questions because not only do they help interviewers thoroughly assess some key skill areas that dentists should have, but it's also for the interviewee, it's also excellent insight into what the potential employers uh, values are, right? Because in the first question, they talked about, okay, how do you essentially, how do you fix a mistake? And then in this one, how do you handle conflict? So, that really kind of reveals to the interviewee, that as a potential employer, you understand that mistakes are made and that conflicts happen, that these things happen. I don't know if you've ever worked in an environment where, mistakes weren't allowed to be made or you weren't allowed to air grievances or things like that, but it can create a very difficult work environment. So as the interviewee, pay attention to these questions and you will get a lot of valuable feedback and insight as to, what you can expect if you are hired on with this potential employer and whether or not that aligns with your goals. And same thing with interviewers as well. Okay. Also, one other note for interviewers, if make sure you tailor these questions to your applicant group, right? Like, so for example, the first question that we asked, the biggest thing that ever went wrong clinically and how did you handle it? And then this one, the conflict question. If you're interviewing a lot of relatively new dentists, like they don't have like a lot of experience, they may not have found themselves in these situations yet, in which case they won't be able to answer the question, in which case you won't get a thorough assessment of their skills. So if you notice that your applicant pool is largely, like the interview pool is largely like newer or greener dentists, provide them with a situation or be prepared to provide them with a situation, right? So, for example, if they've never handled conflict or they've never, come into contact with, major conflicts in their work or in their career as of yet, say, okay, let's say, for example, you witness blah, blah, blah. How would you handle it? And that will still give you a lot of great information. Okay. All right, so just a few points I wanted to make. All right, so question number 3. What would you say when a patient claims that your work is substandard? Okay, this is an excellent question. I really, really love this question. I know it might be nerve-wracking for the interviewees, but don't worry, we're going to get to how to answer it. But I really like this question because, especially with professionals who absolutely love what they do, they have a great passion for what they do. This question can really give you some insight as to how they will react and respond because professionals who have a really strong passion for their work um, can tend to uh, take it personally when someone criticizes that work, right? Because you put your heart and soul into something and someone criticizes it, it's really difficult to kind of handle. So this is a really difficult situation, especially for people who are passionate about what they do. So it gives you a lot of great insight as to how this interviewee could handle that very difficult situation where they feel almost personally attacked, right? Not necessarily, but it could feel that way for them, right? And how they're able to maintain professionality despite that reaction that they may have, right? It also demonstrates the interviewee's ability to use evidence based approaches to resolve patient disputes, okay? And it helps and it helps the interviewer see how the interviewee can establish trust between the employer and the dental care provider, all right, by taking on that question, answering it well, and coming to some sort of resolution, right? So that means that you can trust the interviewee to be able to handle those sorts of things, those difficult situations, right? Okay, so here is the sample answer. When a patient claims that my work is substandard, the best response would be to maintain professionalism and composure. It is important to listen to any concerns they may have and explain in detail why their feedback may not reflect the quality of the work provided. Okay. If necessary, provide evidence about the quality of care, such as statistics or studies conducted in the area. Okay. So again, that's an excellent example, or that's an excellent way to answer that question. It demonstrates that you value maintaining that relationship above kind of, keeping your alleviating your feelings rather, right? Because it is that patient relationship is important. So you want to do everything that you possibly can in order to maintain that relationship and to come to a mutual understanding of what was provided and why. Okay. This answer also demonstrates some really strong active listening skills, right? Because you have to be able to listen to the patient despite whatever feelings you may be having. You need to have those active listening skills in order to really hear what they're saying, not waiting for your turn to talk, but actually taking in that information so that you can provide an appropriate response, right? And so that the patient feels that at the very least they're being heard, even if they are a bit disgruntled or maybe just not very happy. Okay. All right. All right. Next question. Number four. How do you handle someone that is requesting a refund? Okay. So, interviewers, this helps demonstrate the interviewee's ability to professionally and tactfully resolve any disputes or complaints that may arise. At some point, you're going to get a patient who is not happy with the service or with the outcome of the treatment or whatever it is. Okay. So, um, the dentist needs to be able to handle those sorts of things. It also demonstrates the answer can demonstrate the ability to understand difficult conversations and to come up with customized solutions, right? Because each situation is going to be a little bit different, right? So it demonstrates the interviewee's ability to kind of tailor and individualize those solutions to the particular situation. Okay. It also shows that the interviewee's dedication to customer satisfaction and to building those trusting relationships, and their knowledge and ability to comply with industry standards regarding refunds and other customer service issues. Okay. So again, a lot of key information that is related to being a dentist and some key skills that you really need. So here is the sample answer. When dealing with a patient requesting a refund, I always strive to provide excellent customer service and keep open communication. I listen carefully to the patient's concerns and offer sincere solutions. I also stay professional and respectful throughout the conversation. If necessary, I am willing to negotiate or offer discounts on future services to reach a satisfactory resolution for both parties. Ultimately, I aim to ensure the patient's happiness and satisfaction and their experience with their office. This approach helps build trust between myself and my patients, encouraging them to continue using our services in the future. Gold star interviewee, you definitely talked a lot about not only just the patient in the interaction and trying to find a resolution that benefits all parties involved, but you are also focused on the continued success of the office. So that's an excellent example as well. All right. Final question. How do you recognize when to do treatment yourself versus referring to a specialist? This is an excellent question. I like this question as well. This question really for the interviewer, it really helps you gauge just how much introspection this person has, right? Their ability to kind of assess and evaluate and grade their own knowledge, their own skill sets, and how and their level of confidence in what they're bringing to the table, right? It also determines how they make decisions regarding the best course of action for cases that are a little bit more complex, right? You can also glean information regarding their understanding of dental care principles, their teamwork ability, right? Their ability to work as part of a larger healthcare team to provide that holistic care for the patient. Okay. It can also reveal whether or not the interviewee has any experience working with specialists, whether or not they are willing to consult and work with specialists when necessary, demonstrates competency, critical thinking skills, and just how much they prioritize patient care and service. Okay. All right, so sample answer. As a dentist, I understand the importance of recognizing when to do treatment myself and when to refer to a specialist. I carefully evaluate the situation before taking action and ensure my patient's health is always top priority. When determining whether or not to complete a certain procedure, I consider factors such as complexity, severity, and risk. If I assess the situation and conclude that another dentist's expertise will be more beneficial for my patient, I will refer them to a specialist who has the necessary skill set to provide the best care possible. On the other hand, if I can provide quality treatment, I will confidently complete the procedure. Ultimately, my goal is to ensure that my patient receives the highest level of care possible. Excellent answer. No notes, 5 out of 5. Okay, so we've gone over some interview questions and why they're important, why you want to ask them, and how to answer them. Ultimately, it's imperative that as the interviewer, you are asking questions that are directly related to the job and the skills that are needed in order to do the job. And I think these 5 questions, really do that beautifully. Some other questions that you may want to consider asking an interviewee, some questions that you may want to prepare for are: why did you choose dentistry as a career? How would you help an uncomfortable dental patient? What is your bedside manner as a dentist? What is your new patient exam? What is your new patient exam like? How would you handle a patient who needs fill in the blank? What procedures are you most comfortable with? And are there any procedures you're uncomfortable with? Okay. Again, make sure you're relating all of your questions to, gleaning information that is relevant to the specific job. Okay. Alrighty. Alrighty, so that will do it for us today. Thank you for tuning in today with me, everyone. We'll be back next week with a new stream covering a new topic regarding your career in the dental industry. Until then, have a great week. Have a great weekend. Continue to stay safe out there. Be prepared for those interviews, and I'll be back soon. Bye.